My name is Mario Gasparri. I'm a general thoracic surgeon. I do the full gamut of general thoracic. Probably 90% of my practice is robotic. We all know thoracic surgery hurts. That's one of the biggest problems with what we do. In fact, one of my mentors, always taught us, and probably everybody, the two banes of thoracic surgery are pain and air leaks. When I first used Cryo Nerve Block, the first time I ever used it was for a thoracotomy. And I'll be honest, I was a little skeptical about using it in general. Cryo Nerve Block is essentially the act of freezing the nerve. Your range of temperature in which you will freeze the axon and myelin sheath, so that'll be frozen and destroyed, but all your structural, your epineurium, perineurium, endoneurium remains intact. So as the nerve grows back, it has a scaffolding within which to grow. That time frame, that kind of 2 to 3 months, is kind of perfect to get them over the hump and back to normal. So I started using Cryo Nerve Block for thoracotomies because obviously big incisions, a lot of pain, and I really was impressed with how well these patients did. They were having less postoperative pain, and I was very pleased with the results. But it took me a while to incorporate it into my minimally invasive practice because if I do a robot lobe, they're going home on day 1 or 2, and I really never thought I could improve that very much. So I didn't really use it routinely. As far as recovery, there's the standard, when you do an open case, we always say, oh, it's gonna be 8 weeks before you get back to work, and I think that's generally accepted. And then we used to say, well, when we do something minimally invasive, whether it's VATS or robotic, we'd say, oh, we're gonna shorten that. It's gonna be 3 weeks or 4 weeks. And they go home on day 1 or day 2, and we feel really good about ourselves. But if I get them out of the hospital and all they're doing is laying in bed and incapacitated and unable to do things, then I'm not really succeeded in what I'm trying to do. The goal really, if I do a minimally invasive operation, I can get them out of the hospital, but I also want to get them back to full recovery and back to their baseline as fast as possible, because that's kind of part of the whole gamut, right? It's not just length of stay. And I guess most importantly, my APPs, the ones who actually field the calls and take care of these patients, are really asking me to do this. They're on the front lines. They're that layer before the patient gets to me, and they're taking the calls, they're managing the pain, and they want me to use it, and less calls keeps them happy. There's probably some saying in there, like happy wife, happy life, happy PA, happy practice. I don't know, I'll have to come up with something. But the point is, the happier I make them, the better my life is too. Ultimately, we all go in this with the goal of helping patients, whatever field we're in. And technology enables us to do that. If we don't embrace change, especially disruptive change, I think then we're just doing a disservice to our patients.